And thank you for joining us. Here with us is Billie-Jo Hyde, who is a clinical pharmacist. Thank you for being here with us.
Thanks for having me. I love to talk about drugs.
Well, there's a lot to discuss,
yes.
And we'll start with this. National Clean Out Your Medicine Cabinet Day happens in April. Why is that important?
Well, it's just important not to have old or expired drugs hanging around. Plus, too, with all the problems with drug diversion and misuse that we have, having extra things hanging around where people who could put those to not the intended use could get a hold of them. So we always tell patients, keep these medications out of reach of kids. Keep them out of reach of pets. Even your dog will get into your medicine if it smells good, I guess. I don't know. But if you're not using a medication anymore, if your doctor has told you stop taking that, it's a good idea to just get rid of it. That way, too, you don't have to take the chance of, whoops, I took the wrong thing.
And sometimes somebody will pass and you're going through and cleaning out their homes and you come across their medicine cabinet and everything that's in it. I think there's, and probably, I don't know if people have thought this out, but I think maybe for some there's that initial reaction, oh, just flush it down the toilet and be done with it. But that's wrong, because that gets into our water system, and there are proper channels to go through to take care of medicines that have expired or that you are not taking anymore.
Right, and the best thing is to find one of those drug take-back. They used to have days that they would do it, like the sheriff's office or a pharmacy would set it up. But there's so many places in the community now that we have these boxes that you just return it to. One of them is right upstairs in our ER entrance. Before you get to the metal detector, you can just walk in, drop off your medications that aren't being used anymore, and they are securely taken care of and preventing them from getting into the environment.
So you see a variety of folks who come in, maybe somebody getting on a medication for the first time, maybe somebody who has a list of medications, or at least on your end a list. Maybe they don't have a list, which we can talk about.
We always hope they
creating
have a list.
that. Yeah, but just kind of talk about the variety of folks that you see.
Yeah, I mean, we have all walks of life come to our hospital. Meadville Medical Center, I just love it because we are trying to remain an independent hospital. So, there's always an option for everyone. So, we see surgical patients come in. We see patients with chronic illnesses come in. We see young patients, old patients. We're a community hospital. We see the community. And
that's the beauty of it, right? And we've had this theme with the guests that we've had a chance to talk to, where we're sort of all in this together, where it does feel like a family. So we're looking to try to take care of everybody and keep an eye on them. And again, that kind of goes into some things that are important. Somebody, again, may come in and they just need one thing, or maybe they're getting something else and it's part of a list of other medications that they're taking. And I think you start out with maybe one or two and you go, okay, I can kind of keep track of this, but then maybe it's more than that, or you're taking it only certain days of the week or certain times. What advice do you have for patients who are, well, whether it's one medication or multiple, just to kind of keep track of everything?
Always keep a medication list. I can't tell you how many times a medication list is not only helpful, because every time you go to a healthcare provider, they say, what are you taking? And, there's a nurse that's working through on the computer that's trying to make sure that this is all updated for the physician that you're going to see. And, if your physician thinks that you're taking one thing, but you're actually doing something else, that can cause a lot of trouble. Say you're coming to the hospital for hip replacement, and the doctor's going through your medications, and they're going to resume your high blood pressure medicine. Well, what if you're only taking a smaller amount of the medication than you were prescribed? That could cause a lot of problem with low blood pressure after your surgery, which is already, after surgery is kind of a You have a lot of nurses watching over you just to make sure that you don't have trouble after the surgery. So I would never recommend that anyone not take exactly what the physician prescribes, but we've got to know exactly what you're taking to keep you safe and to give you the right medications that might work with that medication instead of against it. So keeping a medication list is so important, first in interacting with other healthcare providers. If you're going to have surgery, they need to know what you're taking ahead of time. If you go see a specialist, they need to know what you're already taking so they can compare that with therapies that, once again, might work with it, might not work with it. And then a medication list can literally save your life. If you've got your medication list in your wallet, say, and you're found you can't speak or communicate for yourself, they're going to look in your wallet, they're going to try to find out who you are, try to find out what medicines you're taking. Because based on what medicines you're taking, that might help the emergency providers figure out, well, let's investigate this, or let's investigate that. And it's knowing what not just because I'm a pharmacist, but knowing what medications you're on can literally save your life and make any interaction with healthcare providers so much more helpful.
It's almost that feeling of when you're a kid and you get called to the principal's office, right? Mm-hmm. It's like, okay, the doctor's asked me a question, I'm going to probably lie about my answer. A doctor's going to know relatively quickly if something's being done and you weren't completely honest with the answer, just off of, as you say, there's other components to the issue, and again, you're talking about potentially saving your life or going the other way. So what should be included when you make that list? What should you have on that list?
Well, number one, the name of the medication. If you can include both of them, which is a brand and a generic name, that's great. If you can only write down the generic name or the brand name, we'll deal with it. Here in the hospital, we have a few computer programs that tell us the names of all sorts of medicines. Then we need to know what dose you're taking. And don't just say one tablet. Because, for example, there's blood pressure medicines that come in 5 different strengths. And if you say, I take 1 tablet of lisinopril every day, well, is it the 40 or is it the 2.5? There's a huge difference there, and it can make a world of difference. How often are you taking it? And once again, please be truthful. There's one thing where the physician is telling you what you're taking, and ideally that is what you're taking. If you ever aren't taking exactly what your physician tells you to take, you need to discuss that with them. Very important. But the name of the drug, how much you're taking, the strength of the tablet, how often you're taking it, who is prescribing this for you. So, for example, if you take a very specialized seizure medication and it's a neurologist in Pittsburgh that is prescribing it for you compared to someone local, if there's a question about it, they're going to want to contact that neurologist, that specialist that's been taking care of you for a while. Ideally, you'll include what is it for. Some medications, generically, we refer to it as an antidepressant, but it's used for migraines. So if you show up with terrible migraine symptoms, which can appear, a really bad migraine can mimic a stroke or something else. But if we know that you have migraines, okay, let's work that way. They'll also check out the stroke symptoms, but knowing what each medication is for is good as well. Now, usually when we're making a medication list, we just think of the things that we get prescriptions for and we bring home from the hospital. Another really important thing are the things that you might only get at the physician's office. So, for example, if you're undergoing chemotherapy or immune therapy up at the Barco Center, make sure and include that on your medication list. For example, if you're getting immune therapy and the dermatologist would like to do a biopsy of a lesion on your skin, they might want to time that a particular way depending on what cycle you're getting. Another thing would be injections for osteoporosis. You know, it used to be that you had to take a tablet every day, first thing in the morning with water, do not eat or drink for half an hour or an hour after it. And now we have medications that do the exact same thing. It's an injection every 3 months, some of them even every year.
Wow.
But if you have to have any dental work, those are things that can cause a problem with the dental work. So you want to make sure to include those, even if it's an injection that you just get once in a while, on your medication list. So these are things that we don't always think about, and keeping it up to date. I can't stress enough keeping it up to date. Well, my dose changed last week. I just haven't gotten it updated. I'm giving myself these injections at home, but it's only for a week until I go to surgery. All that needs to be on your medication list, because once again, you know, say you're using an injectable blood thinner getting ready for surgery, or you just had surgery. If you can't speak for yourself and you need to get to the emergency room, they need to know that you're on a blood thinner.
What about things like flu shots?
Mm-hmm.
Something else you should be keeping track of?
Absolutely.
Okay.
Keeping track of vaccines is really important. You know, the recommendations are changing all the time, and we'll go with pneumococcal. It's for one of the pneumonia vaccines.
Okay.
So, you know, it used to be one injection, then there were 2 formulations, and you need to get one. If you have one, then you get the other 6 months later, but if you have another, you got to wait a year to get the other. So keeping a list of your vaccines would be very helpful. I mean, and then you know that, well, I've got my flu shot this year. We're good to go with that.
Do you find that folks are using like paper to keep
Mm-hmm.
track of this? Are they keeping it on their smartphones? What are some things you suggest just for better?
Yeah, all of the above. Figure out
Okay.
what works for you. My little list of papers, pile of papers here. I've made some examples, but I mean, AARP has examples. The FDA has examples, and they're just blank lists that you can go fill out. This one's, I mean, there's just so many options. You can put in a whole bunch of information, or some of them are kind of less information. You can use a full-size sheet of paper. You can use an index card that fits in your wallet better. But always keep a copy in your wallet. Keep a copy in your pocketbook, whichever one works. There is PennDOT's yellow dot program that you put a yellow dot on your car, and that tells any emergency responders that you have information in your glove compartment. So that's a good place to keep your medication list. You can keep a copy on your fridge. There's different programs that alert patients to that. I believe it's called Vial of Life.
Okay.
There's medication alert jewelry. You could literally have one engraved with, find my medication list in my, anything like that.
So pretty soon we'll see some pretty cool bling in the gift shop at the hospital where you can get your...
Well, the volunteers...
Marketing's working on that right now.
The volunteers do provide us with some medication alert jewelry, just the very basic ones. I have diabetes, I have hypertension. We used to hand them out for patients who started blood thinners like Coumadin. I know that we've had them. I don't know exactly where the bin is right now because I haven't went to get one just lately.
But that's just to identify, like the
Right.
example that you have, you're diabetic, or, but to actually keep your medications or
Right.
to know the dosage. That's where that's really important to have that piece of paper or that
Yes.
index card.
Yes. So keep, and have a trusted family member or friend know where one is. that way, once again, in the event of an emergency, they're like, oh, the medication list is over here, let me bring it in for you. If your doctor's office will take a copy of it, great. If you are tech savvy, do it right on the computer. Just type it out. I do this for my parents, and they said that I could mention them. Thanks, Mom and Dad. But you just type it out, and then it's so easy. Anytime anything changes, you go back to your computer, you revise it, add stuff, change doses, whatever, print out another copy. Print out a copy for your wallet. Print out a copy for wherever you keep it in an emergency. There's just so many options to keeping a medication list. Another one I saw a patient do one time is, when you pick up your prescriptions, you get the little sticker, the little receipt. They just got a piece of paper and just put all the stickers on one piece of paper.
That's a good idea.
That's, if it's difficult for you to write, or, that's a pretty handy way to do it. But you've got to take them exactly how it's listed on that prescription. So, and then, if a pharmacist sees that you've got this paper and there's certain pharmacies on there, they can even contact that pharmacy if they have any questions to fill it up. And speaking of that, we have a technician in the emergency room that's all she does all day, is work on medication lists with families. So as the patients are getting admitted, we try to have as good a picture as possible of what they're taking as an outpatient. Because, if there was a medication misadventure that got you admitted, we want to make sure that we have, the right medication, the right dose, and all of that. And we have pharmacists that work in surgery who will, work with the nurses to hopefully make sure that all those patients that are undergoing surgery have the best medication list that they can have.
Doctors do a really good job keeping track of maybe a medication that somebody might be allergic to, but sometimes that gets missed, or if you're not sharing the information,
right,
they don't have that. So is it important to include something like that on the list?
Right. There's so many things that you can put on your medication list which are so helpful.
As long as you're keeping it up to date.
Yes.
Okay.
Keep it up to date. So you can include your allergies. For example, maybe someone's allergic to Neosporin, but it's only the neomycin part that they're allergic to. Double antibiotic, or the polymyx and bacitracin, is fine. So, if you have an allergy, but you've been told that a similar medication is okay, that's great information to have. So maybe for cholesterol, you take Lipitor. You tried another one sometime and it just didn't work well for you. So that's good to say, Lipitor is fine. This other one doesn't work so good for me. Maybe you've had stents in your heart. That's helpful information. Do you use CPAP or BiPAP to help you breathe when you sleep at night? Did the kidney doctor say, don't use any NSAIDs? Not that you're allergic to them, but he's done a really good job preserving your kidney function. Don't use any of those.
What about like over-the-counter stuff? I mean, cold and sinus medications, or if you're taking, aspirin once a day or something. I mean, things like that should also be included?
Yes. Anything, and we call it PRN, if you ever hear that. That's pretty common medical lingo. But anything you use that's just as needed. So, for example, on my list, I include Tylenol, ibuprofen, anything else you might use, and including herbs, supplements, complementary things. St. John's wort, echinacea. Do you use the zinc nasal spray? Anything like that. Because there are some drug interactions that, if you're going to use one thing, we would probably not use another thing. Even though they're available over the counter with no prescription, it doesn't mean that they're completely safe. And like I said, there are some drug interactions with those.
When you're keeping that list up to date, are you scratching off things that you are done taking, or do you kind of keep that on the list so that somebody knows, they did take this maybe 6 months ago or a year ago?
So if you have frequent changes, say you just went through a steroid burst. Maybe you have asthma and you took steroids for, just a little while, but then you're off of them. Something like that you might cross off and say, I finished this on so-and-so. That said, you don't want to clutter up your medication list too much. Every so often you need to start with just a brand new one. But, steroids, if you're going through a course of antibiotic, you might want to keep that on there for a few weeks maybe, just in case something would happen later on that you need more medical attention on that end for. Then you can say, well, I did a course of cephalexin. I did a course of Septra. And now I'm in the hospital because I need more attention. It's very helpful to know what you might have cycled through before. But like I said, we don't want that list too cluttered up. And if you're not taking it, definitely cross it off if you've finished that course.
What sometimes as you're wrapping up with the doctor and maybe the nurse comes in and says, okay, doctor's prescribing this, go, we're calling it into the pharmacist. Sometimes I think maybe some people will check out a little bit because they know I just have to hand it to the pharmacist. They're going to give me, but they should be listening and paying attention, correct?
Absolutely. And, with a lot of the physicians now, you get an after-visit summary. You'll actually have printed information to take with you. Especially in when you have a physician's visit where something significant is being changed, you want that in writing. Whether it's you just writing it down, whether it's like, hey, doc, you're going to write that down for me, right? You need to have that written down. It is so easy to get home and, maybe the physician gave you samples. And you get home and you have these samples and you're like, well, it doesn't tell me when to take it or anything like that. So, yeah, anytime medications change, you've already had your medication list out. Maybe it's blank on the back and you can just write down real quick, what you're supposed to take. And a lot of times patients aren't taking a prescription with them to the pharmacy anymore. So many of them are transmitted electronically that, you'll never see anything till you pick it up. And, if you are getting a medication changed, make sure and know what it's for. And make sure and know what it is because you write it down. Because if you get to the pharmacy and, the physicians, if they're prescribing electronically, they have to go through a big, huge list of medications. We're human, things happen. Make sure and know what you're supposed to take and what it's for. And then when you get to the pharmacy, double check that. If the pharmacist offers to talk to you, please talk to them because, just that little bit of communication could prevent a medication error.
Actually, that kind of leads into the safety side of it, right? Where there are some important questions you can ask your pharmacist, conversations that you can have,
right.
From brand versus generic to this. I found this to be fascinating. Is it safe around other people? Like, is this something that, like, if I know I've got grandkids or pets or those things we talked about at the beginning, should it be locked up? Should it be put away? Could it be used for other things? So there's a lot that really goes into that side of it.
Definitely keep medications where kids and pets cannot get at them. Accidents happen and accidents happen fast. So make sure and, not out on the kitchen table, maybe not even up in the cupboard. It needs to be higher up in the cupboard. But there's some medications that can be toxic to people and, they don't even actually touch the medication. When, there's some of the things with very specialized oncology or immune therapy. And, anybody who's going into that sort of treatment gets a lot of counseling that, you need to be very careful around other people, or radiation, anything like that. And that's a very specialized thing. I'm not even going to go into that. Most chemotherapy, it's not a problem, being in the house with everybody else. But one of the things that we started to notice when they started compounding testosterone cream, people would be rubbing it in their skin and then they'd handle their grandkids. And some of that would rub off on the grandkids. So you just have to be careful, rub it in very well, wash your hands when you're done, before you're playing with the grandkids, maybe put long sleeves on, or, maybe you can apply it somewhere where it'll be covered with clothing anyway.
The upside is the kid hit like 4 home runs that night. So, I mean, but there is a danger to that.
Right.
And yeah.
Right.
Now, boy, there's so much we could get into. Let's talk about the questions that might be good to have with a pharmacist. What are some things people should ask?
So we've already talked about brand and generic names. What does it look like? So, say thyroid medication. I think there's about 10 different strengths. They're all different colors. There's different generics now, so there's different shapes. Basically, anytime you pick up a refill, make sure it looks like what it looked like before. If it doesn't, just ask the pharmacist why. Maybe they changed brands. I know that happens quite a bit. It's more of an oblong versus a football, but it's all the same stuff. But just make sure that it looks the same as it did. What does it do and why are you taking it? Hopefully you know that when you left the physician's office, but with the world of medical information, it's just better to hear it repeatedly.
And not getting it online, actually either from the doctor or from the pharmacist.
Ideally, yes. You ask Hey Google a question and you might get a plethora of responses that may or may not be helpful.
Or anyone else taking this,
Yes.
am I taking the right amount? I was like, well, no, everybody's different. You can't be doing that.
Yeah, everybody's different. And you might look online and it says, well, a standard course is about 21 days, but my doctor only ordered 10 days. Well, 10 days is fine for an initial course. But do you take it with food or an empty stomach? I learned the with food thing the hard way one time. But, some medications need an empty stomach to make sure that they're absorbed the best. Other medications need to be taken with food to make sure that they absorb the best. If you're getting a liquid or what looks like a lotion, is it oral? Is it topical? That suspension that you got for your child's ear infection, it's probably something that you're supposed to swallow, not pour in their ear. But then we do have ear drops for ear infections. So make sure you know where it's supposed to go.
And if you go to a pharmacist who isn't providing you with that information, maybe they should be looking for a different pharmacist?
Just make sure and ask. The pressures on pharmacists these days, I'm so blessed to work at Meadville Medical Center. I love it. I love what we're trying to do. But ask. Always ask.
And that's the big takeaway, is just ask. And
Yes.
Getting ready to talk to you, you provide a lot of wonderful information. Well, no, but that just shows, again, the passion for what you do, the concern that you have. And these are probably neighbors, family members that are coming in that
We are the community taking care of the community. So one last thing I've got to mention. Do not keep your medications with other things. So the tube of cream or ointment in the dark can look a lot like your tube of toothpaste.
Ooh.
Yeah. So anytime you're going to take your medications, turn on the lights, put on your glasses if you need them, make sure you know what you're doing. The example that they gave us in school was a patient who had her eye drops right next to the super glue, and she glued her eye shut. So make sure you know where it's supposed to go. Do not keep other things around your medications. Don't mix them up. Keep your medication list up to date. Use a pill box. Oh my goodness, I joke with my parents all the time. You sent me to pharmacy school so I could keep your medicines up to date. Every week, fill in their pill box, and, I just couldn't love it anymore.
And if somebody does make a mistake, what should they do?
So I have run into this before where, maybe take your morning pills in the night or take the night pills in the morning. It all depends what you're taking. If you're taking a medication, say, there's some very high-powered seizure medications that you have to take at night. If you take it in the morning, you might end up sleeping it off. But, monitor yourself, You can always call poison control and say, hey, I took this in the day instead of the night. What should I do? Call your doctor. Call your pharmacist. Make sure and ask somebody. Don't just Google it. I took my medication at the wrong time. What should I do? But definitely ask. There might be some more monitoring that you need to do. There's a few medications that if you double up, we really need to keep a closer eye on you, but just make sure and ask.
And if somebody does have questions, they can come in and see you or ask their pharmacist?
It's kind of harder in the pharmacy.
Okay.
I mean, in the hospital, we do have mill-run pharmacy. But wherever you usually get your medicines, ideally you get your medicines all from the same place. There are some medications that you can get from a patient assistance program. So, you get them; they're directly mailed to you instead of getting them right from the pharmacy. But hopefully, everybody has some sort of relationship with a pharmacist. It's easy for my family. They have my number. Any patient who is admitted to the hospitalist service here in the hospital, there is a pharmacist rounding with them. There's a pharmacist in the ICU. It's kind of hard, being a hospital, we're kind of, delegated to certain roles, but there are outpatient pharmacists that highly recommend. Just talk to them.
The big takeaway is ask questions.
Yes.
Ask.
Yes.
All right. Billie-Jo Hyde joining us. Thank you so much for your time.
Thanks for having me.
I learned a lot.
It was fun.
Thank you. And thank you for joining us.